Hey, what up? This lecture is going to cover Chapter 4 of the muscle system, so let's get started. First, with a basic overlook, we'll look at the functions of the muscle system. Muscles hold the body erect and make movement possible. Muscle movement generates nearly 85% of the heat that keeps the body warm. Muscles move food through the digestive system. Muscle movement, such as walking, aids the flow of blood flow through veins as it returns to the heart. And muscle action moves fluid through ducts and tubes associated with other body systems. Now let's look at muscle structures. The body has more than 600 muscles, which is nearly half your body weight. These muscles are made up of fibers which are covered in fascia and are attached to bones by tendons. The muscles are composed of long, slender cells known as muscle fibers. A fiber is a thread-like structure. Each muscle consists of a group of fibers that are held together by connective tissue and enclosed in a fibrous sheath. Fascia is the sheet or band of fibrous connective tissue that covers, supports, and separates muscle. A tendon is a narrow band of non-elastic, dense fibrous connective tissue that attaches a muscle to a bone. For the example that's provided here, we have the Achilles tendon, which attaches the gastrocnemius muscle to the heel bone. Be careful not to confuse tendons and ligaments, because ligaments connect one bone to another bone. An aponeurosis is a flat, fibrous sheet of connective tissue that is very similar to a tendon. However, an aponeurosis attaches a muscle to a bone or to other tissues. As an example, the abdominal aponeurosis can be seen in figure 4.7 in your book. Now that we've covered the functions and structures of muscle, let's check out different types of muscle tissue. The three types of muscle tissue are skeletal, smooth, and cardiac. The types of muscle are described according to their appearance and function. So while we cover the following terms, we'll be going in order from skeletal to smooth to cardiac muscle. Skeletal muscles attach to the bones of the skeleton and are the muscles that make possible body motions such as walking and smiling. Skeletal muscles are known as striated muscles because of the dark and light bands in the muscle fibers that create a striped appearance. Skeletal muscles are also known as voluntary muscles because we have conscious control over these muscles. Next, we have smooth muscles. Smooth muscles are located in the walls of internal organs such as the digestive tract, blood vessels, and ducts leading from glands. Their function is to move and control the flow of fluids through the structures. Smooth muscles are also known as unstriated muscles because they do not have the dark and light bands that produce the striped appearance seen in striated muscles. Smooth muscles are also known as involuntary muscles because they are under the control of autonomic nervous system and are not under voluntary control. Smooth muscles are also known as visceral muscles because they're found in the large internal organs except for the heart and in hollow structures such as those of digestive and urinary systems. Cardiac muscle, also known as myocardial muscle, forms the muscular wall of the heart. This muscle is also known as the myocardium. Myo meaning muscle, cardio meaning heart, and ium meaning tissue. Cardiac muscle is specialized tissue that is striated muscle in appearance, but like smooth muscle in action. It is a contraction and relaxation of this muscle that causes the heartbeat. Now we can look at the characteristics of muscles. Kinesiology is the study of muscular activity and the resulting movement of body parts. Kinesio means movement, and ology means the study of. The muscles are arranged in antagonistic pairs. Antagonistic means to work in opposition to each other. In an antagonistic pair, one muscle provides movement in one direction and the other muscle provides movement in the opposite direction. Contraction and relaxation. Muscles are made up of specialized cells that can change length or shape by contracting and relaxing. These contrasting actions make motion possible. Contraction is the tightening of a muscle. As the muscle contracts, it becomes shorter and thicker, causing the belly of the muscle to enlarge. Relaxation occurs when a muscle returns to its original form. As the muscle relaxes, it becomes longer and thinner, and its belly is no longer enlarged. When one muscle of a pair contracts, the other usually relaxes. Muscle tone, also known as tonus, is the normal state of balanced muscle tension that is required to hold the body in an awake position. Muscle innervation. Muscle innervation is the stimulation of the muscle by an impulse transmitted by a motor nerve. The stimulation causes the muscle to contract, and then when the stimulation stops, the muscle relaxes. Neuromuscular means pertaining to the relationship between the nerve and the muscle. If the nerve impulse is interrupted because of injury or pathology of the nervous system, the muscle is paralyzed and cannot contract. Now let's look at range of motion. Range of motion is the change in joint position that is produced by muscle movements. We're going to look at all those now. We're going to begin with contrasting muscle motions on Table 4.1. Abduction moves away from the midline. Adduction moves towards the midline. Flexion decreases an angle, like bending a joint. Extension increases an angle, like straightening a joint. Elevation raises a body part. Depression lowers a body part. Rotation turns a bone on its own axis. Circumduction turns at the far end. Supination turns the palm upward or forward. Pronation turns the palm downward or backward. Dorsiflexion bends the foot upward at the ankle. Plantar flexion bends the foot downward at the ankle. Now, we'll discuss these terms as they pertain to range of motion. First, we'll begin with abduction and adduction, then we'll move to flexion and extension, then we'll discuss elevation and depression, then we'll look at rotation and circumduction, supination and pronation, then finally dorsiflexion and plantar flexion. Follow along with the terms while we discuss. Abduction, as you'll remember, is the movement away from the midline of the body. For example, during abduction, the arm moves outward, away from the side of the body. An abductor is a muscle that moves a part away from the midline. Adduction is movement toward the midline of the body. For example, during adduction, the arm moves inward towards the side of the body. An adductor is a muscle that moves a body part toward the midline. Flexation means decreasing the angle between two bones or bending a limb at the joint. During flexation of the arm, the elbow is bent and the lower arm is brought upward. During flexation of the leg, the knee is bent and the lower leg is brought backward. A flexor is a muscle that bends a limb at a joint. Extension means increasing the angle between two bones or straightening out a limb. During extension of the arm, the elbow is straightened and the lower arm is brought downward. During extension of the leg, the knee is straightened and the lower leg is brought forward. An extensor is a muscle that straightens a limb at a joint. Hyperextension is the extreme or overextension of a limb or body part beyond its normal limit. For example, movement of the head far backward or far forward beyond the normal range of motion causes hyperextension of the muscles of the neck. Elevation is the act of raising or lifting a body part, such as raising the ribs when breathing in. A levator is a muscle that raises a body part. For example, levator anguli oris raises the corner of the mouth. Anguli means angle, and oris means mouth. Depression is the act of lowering a body part, such as lowering the ribs when breathing out. A depressor is a muscle that lowers a body part. For example, the depressor anguli oris lowers the corner of the mouth. Rotation is a circular movement around an axis. Turning the head when saying no is an example of rotation. A rotator muscle turns a body part on its axis. An axis is the central line of the body or any of its parts. For example, the head of the humerus, the upper arm bone, rotates within the shoulder joint. The rotator cuff is the group of muscles that hold the head of the humerus securely in place as it rotates within the circular joint. Circumduction is the circular movement of a limb at the far end. An example of circumduction is the swinging motion of the far end of the arm when throwing a ball. Supination is the act of rotating the arm or the leg so that the palm of the hand or sole of the foot is turned forward or upward. Pronation is the act of rotating the arm or the leg so that the palm of the hand or sole of the foot is turned downward or backward. Dorsiflexion bends the foot upward at the ankle. Pointing the toes and foot upward narrows the angle between the top of the foot and the front of the leg. Plantar flexion bends the foot downward at the ankle. Plantar means pertaining to the sole of the foot. Pointing the toes and foot downward increases the angle between the top of the foot and the front of the leg. Next, we're going to look at how muscles are named. For this, we're going to be on page 67 through 69 in our book, and you're going to want to reference figures 4.7 through 4.11. Some muscles are named by joining the name of the place of origin to the name of the place of insertion. Muscle origin is the place where the muscle begins or originates. This is more fixed attachment or the end of the muscle nearest to the midline of the body. Muscle insertion is the place where the muscle ends or inserts. It is the more movable end or the portion of the muscle farthest from the midline of the body. For example, the sternocleidomastoid muscle, which helps flex the neck and rotate the head, is named for its origin and insertion. This muscle, which has two origins, begins near the midline from the sternum, also known as the breastbone, and clavicle, also known as the collarbone. It inserts away from the midline into the mastoid process of the temporal bone, located just behind the ear. Muscles named for their action. Some muscles are named for their action, such as flexing or extending. For example, the flexor carpi muscles work with the extensor carpi muscles to make possible the flexion and extension motions of the wrist. Muscles named for their location. Some muscles are named for the location on the body or the origin that they're near. The pectoralis major is an important muscle of the chest, and pectoral means relating to the chest. Other muscles, such as vastus lateralis and vastus medialis, indicate their location by including lateral, toward the side, and medial, toward the midline, in their names. Some muscles indicate their location by including external, near the surface, and internal, deeper location, in their names. Examples are external oblique and internal oblique muscles. Muscles named for fiber direction. Some muscles are named for the direction in which their fibers run. Rectus means straight. For example, rectus abdominis is the abdominal muscle in straight alignment with the vertical axis of the body. Oblique means slanted or at an angle. For example, the external abdominal oblique is an abdominal muscle that slants outward at an oblique angle away from the midline. Transverse means in a crosswise direction. For example, the transverse abdominis is an abdominal muscle with a crosswise alignment. A sphincter is a ring-like muscle that tightly constricts the opening of a passageway. A sphincter is named for a passage involved. For example, the anal sphincter closes the anus. Muscles named for number of divisions. Muscles may be named according to the number of divisions forming them. The biceps brachii, also known as the biceps muscle, is formed from two divisions, bi meaning two and ceps meaning head. This is the muscle of the anterior upper arm that flexes the elbow. The triceps brachii, also known as the triceps muscle, is formed from three divisions, tri meaning three and ceps meaning head. This is the muscle of the posterior upper arm that extends the elbow. The quadriceps femoris is formed from four muscle divisions, quadra meaning four and ceps meaning head. This large muscle, which is located on the anterior thigh, assists in extending the femur, which is the bone of the upper leg. Muscles named for their size. Some muscles are named because they are broad or narrow, or large or small. For example, the gluteus maximus is the largest muscle of the buttock. Muscles named for their shape. Other muscles are named because they are shaped like a familiar object. The deltoid muscle, which forms the muscular shoulder cap, is shaped like an inverted triangle, or the Greek letter delta. Now let's take a look at some of the medical specialties related to the muscular system. An orthopedic surgeon treats injuries and disorders involving bones, joints, muscles, and tendons. A rheumatologist treats disorders that involve the inflammation of connective tissues, including muscles. A neurologist treats the cause of paralysis and similar muscular disorders in which there is a loss of function. A specialist in sports medicine treats sports-related injuries of the bones, joints, and muscles. Smooth muscle disorders. Smooth muscles are a key component in most body systems. The specialist who treats the involved system also cares for any involved muscles. Cardiac muscle disorders. A cardiologist treats disorders of the cardiac muscles. We'll now check out the diseases and disorders related to the muscular system. Pathology of the fibers, fascia, and tendons. Fasciitis is inflammation of a fascia. Fascio meaning fascia, and itis meaning inflammation. This term is spelled correctly with two i's next to each other, but fasciitis is also an acceptable spelling. Tenalgia is pain in a tendon. Teno meaning tendon, and algia meaning pain. It is also known as tenodynia. Tendinitis is inflammation of the tendons caused by excessive or unusual use of the joint. Tendono meaning tendon, and itis meaning inflammation. It's also known as tendonitis. Overuse tendinitis is an inflammation of the tendons caused by an excessive or unusual use of a joint. Pathology of muscles. An adhesion is a band of fibrous tissue that holds structures together abnormally. Adhesions may form in muscles and internal organs as a result of an injury or from surgery. Muscle atrophy is the weakness and wasting away of muscle tissue. It may be caused by pathology or by disease of the muscle over a long period of time. Myalgia means muscle tenderness or pain. Myo meaning muscle, and algia meaning pain. Myolysis is the degeneration, breaking down of muscle tissue. Myo meaning muscle, and lysis meaning destruction or breaking down in disease. Myositis is inflammation of muscle tissue, especially skeletal muscles. Myos meaning muscle, and itis meaning inflammation. Polymyositis is a chronic progressive disease affecting the skeletal muscles that is characterized by muscle weakness and atrophy. Poly meaning many, myos meaning muscle, and itis meaning inflammation. Myomalacia is abnormal softening of muscle tissue. Myo meaning muscle, and malacia meaning abnormal softening. Myorexis is the rupture of a muscle. Myo meaning muscle, and rexis meaning rupture. Myosclerosis is abnormal hardening of muscle tissue. Myo meaning muscle, and sclerosis meaning abnormal hardening. Now we'll look at hernias, muscle tone, and voluntary muscle movements. A hernia is the protrusion of a part or structure through the tissues normally containing it. A myocele is the protrusion of a muscle through its ruptured sheath or fascia. Myo meaning muscle, and celle meaning hernia. Now let's look at differences in muscle tone. Atonic means the lack of normal muscle tone. A means without, ton means tone, and ic means pertaining to. Dystonia is the condition of abnormal muscle tone. Dys means bad, ton means tone, and ia means condition. Hypertonia is a condition of excessive tone of the skeletal muscles with an increased resistance of muscle to passive stretching. Hyper meaning excessive, tone mean tone, and ia meaning condition. Hypotonia is a condition of diminished muscle tone of the skeletal muscles with decreased resistance of muscle to passive stretching. Hypo meaning deficient, ton meaning tone, and ia meaning condition. Myotnia is a delayed relaxation of the muscle after a strong contraction. Myo meaning muscle, ton meaning tone, and ia meaning condition. Voluntary muscle movements. Ataxia is an inability to coordinate the muscles in the execution of voluntary movement. A means without, tax means coordination, and ia means condition. Dystaxia, also known as partial ataxia, is difficulty in controlling voluntary movement. Dys means bad, tax means coordination, and ia means condition. A contracture is an abnormal shortening of muscle tissues, making the muscle resistant to stretching. Intermittent claudication is a complex of symptoms including cramp-like pain of the leg muscles caused by poor circulation. It may be an indication of a larger cardiovascular problem. A spasm, also known as a cramp, is a sudden, violent, involuntary contraction of a muscle or a group of muscles. Spasmodic torticollis, also known as wry neck, is a stiff neck due to spasmodic contraction of the neck muscles that pull the head toward the affected side. Bradykinesia means extreme slowness in movement. Brady meaning slow, kineso meaning movement, and ia meaning condition. Dyskinesia means distortion or impairment of voluntary movement, as in a tic or a spasm. Dys means bad, kineso means movement, and ia means condition. Hyperkinesia, also known as hyperactivity, means abnormally increased motor function or activity. Hyper means excessive, kineso meaning movement, and ia meaning condition. Hypokinesia is abnormally decreased motor function or activity. Hypo meaning deficient, kinesio meaning movement, and ia meaning condition. Tardive dyskinesia is the late appearance of dyskinesia as a side effect of long-term treatment with certain antipsychotic drugs. Tardive meaning lateness in appearance. Myoclonus is a spasm or twitching of a muscle or group of muscles. Myo meaning muscle, clon meaning violent action, and us is a singular noun ending. Nocturnal myoclonus is jerking of the limbs that may occur normally as a person is falling asleep. Nocturnal means pertaining to night. Singultus, also known as hiccups, is myoclonus of the diaphragm that causes the characteristic hiccup sound with each spasm. The diaphragm is the muscle separating the chest and the abdomen. Myasthenia is a muscle weakness from any cause. Maya meaning muscle, and essentia meaning weakness or lack of strength. Myasthenia gravis, also known as MG, is a chronic autoimmune disease in which there is an abnormality in the neuromuscular function causing episodes of muscle weakness. MG most frequently affects the muscles that control eye movements, eyelids, chewing, swallowing, coughing, and facial expression. Muscular dystrophy is a group of inherited muscle disorders that can cause muscle weakness without affecting the nervous system. The most common forms which affect only males are Duchenne's muscular dystrophy, DMD, and Becker's muscular dystrophy, BMD. Duchenne's muscular dystrophy appears from 2 to 6 years of age and progresses slowly. However, survival is rare beyond the late 20s. Becker's muscular dystrophy is a less severe illness and does not appear until early adolescence or adulthood. The progression is slower with survival well into the middle to late adulthood. Fibromyalgia syndrome is a chronic disorder of unknown cause characterized by widespread aching pain, tender points, and fatigue. Fibro means fibrous connective tissue, myo means muscle, and algia means pain. Also known as FMS, the syndrome does not cause joint deformity, is not progressive, and is not crippling. Tender points, which are abnormal localized areas of soreness, are important diagnostic indicators of FMS. These points occur at predictable locations at the base of the neck, along the backbone, in front of the hip and elbow, and at the rear of the knee and shoulder. Repetitive stress disorders have symptoms caused by repetitive motions that involve muscles, tendons, nerves, and joints. These conditions most commonly occur as workplace or sports injuries. Ergonomics is the study of human factors that affect the design and operation of tools and the work environment. Ergo means work, nom means control, and ix means pertaining to. The term ergonomic is applied to the design of sports equipment. Overuse injuries are minor tissue injuries that have not been given the proper time to heal. Such injuries may be caused by spending hours at the keyboard or by lengthy sports training sessions. Myofascial damage, which can be caused by overworking the muscles, results in tenderness and swelling of the muscles and their surrounding tissues. Myo meaning muscle, fascia meaning fascia, and al means pertaining to. Rotator cuff injuries. Rotator cuff tendinitis is an inflammation of the tendons of the rotator cuff. This condition is often named for the cause, such as tennis shoulder or pitcher's shoulder. Impingement syndrome occurs when the tendons become inflamed and get caught in the narrow space between the bones within the shoulder joint. Calcium deposits may form within the tendons of the rotator cuff. These deposits cause chronic irritation of the tendons. If left untreated, or if the overuse continues, the irritated tendon may weaken and tear, becoming a torn tendon. Carpal tunnel syndrome. The carpal tunnel is a narrow bony passage under the carpal ligament located 1/4 inch below the inner surface of the wrist. The median nerve and the tendons that bend the fingers pass through this tunnel. Carpal means pertaining to the wrist. Carpal tunnel syndrome occurs when the tendons passing through the carpal tunnel are chronically overused and become inflamed and swollen. This swelling creates compression on the median nerve as it passes through the carpal tunnel. This causes pain, burning, and paresthesia in the fingers and hand. Cervical radiculopathy is nerve pain caused by pressure on the spinal nerve roots in the neck region. Cervical meaning neck, and radiculo meaning nerve root, and pathy meaning disease. This pressure may be caused by muscle spasms due to repetitive motions or by compression of cervical vertebral discs. Epicondylitis is inflammation of the tissue surrounding the elbow. Lateral epicondylitis, with pain on the outer side of the arm of the forearm, is also known as tennis elbow. The medial epicondylitis, with pain on the palm side of the forearm, is also known as golfer's elbow. Plantar fasciitis is an inflammation of the plantar fascia, causing foot or heel pain when walking or running. A heel spur is a thickening of the surface of the calcaneus bone that causes severe pain when standing. Sports injuries. A sprain is an injury to a joint, such as an ankle, knee, or wrist. Frequently caused by overuse, a sprain frequently involves a stretched or torn ligament. A strain is an injury to the body of a muscle or attachment of the tendon. Strains usually are associated with the overuse injuries that involve a stretched or torn muscle or tendon attachment. Although sprain and strain have different meanings, these terms are frequently used interchangeably. A shin splint is pain caused by a muscle tearing away from the tibia, which is also known as the shin bone. The shin splints can develop into the anterolateral, front and side muscles, or in the posterior medial, back and side muscles of the lower leg. This type of injury is usually caused by repeated stress to the lower leg. A hamstring injury may be the strain or tear of the posterior femoral muscles. Hamstring refers to the 3 muscles on the posterior of the thigh that straighten the hip and bend the knee. These injuries usually cause sudden pain in the back of the thigh as these muscles contract suddenly. Achilles tendinitis is a painful inflammation of the Achilles tendon caused by excessive stress being placed on the tendon. Paralysis. Myoparesis is a weakness or slight paralysis of a muscle. Myo meaning muscle, and paresis meaning partial or incomplete paralysis. Hemiparesis means slight paralysis of one side of the body. Hemi meaning half, and paresis meaning partial or incomplete paralysis. Paralysis is the loss of sensation and voluntary muscle movements through disease or injury to its nerve supply. Damage may be either temporary or permanent. A spinal cord injury often causes paralysis because nerve impulses cannot be carried below the level of the injury. Paraplegia is the paralysis of both legs and the lower part of the body. An individual affected with paraplegia is known as a paraplegic. An SCI below the cervical vertebrae results in paraplegia. Quadriplegia is the paralysis of all 4 extremities. Quadra meaning 4 and plegia meaning paralysis. An SCI involving the cervical vertebrae causes quadriplegia. If the injury is above C5, it also affects respiration. Hemiplegia is the total paralysis of one side of the body. Hemi meaning half and plegia meaning paralysis. This form of paralysis is usually associated with a stroke or brain damage. Damage to one side of the brain causes paralysis on the opposite side of the body. Cardioplasia is paralysis of the muscles of the heart. Cardio meaning heart, and plasia meaning paralysis. Now let's look at the diagnostic procedures of the muscular system. We've got deep tendon reflexes, DTR. Those are tested with a reflex hammer used to strike a tendon. If we look in figure 4.16, it shows reflex testing on the kneecap, the patellar reflex, and Achilles tendon calcaneus reflex. No response or an abnormal response may indicate a disruption of the nerve supply of the involved muscles. Reflexes also are lost in deep coma or because of medications such as heavy sedation. Electromyography, also known as an EMG, records the strength of muscle contractions as the result of electrical stimulation. The resulting record is called an electromyogram. Electro meaning electricity, myo meaning muscle, and gram meaning record. This test may be helpful in determining the cause of pain, numbness, tingling, or weakness in the muscle or nerves. Electroneuromyography, also known as nerve conduction study, is a procedure for testing and recording neuromuscular activity by the electric stimulation of the nerve trunk that carries fibers to and from the muscle. Electro means electricity, neuro means nerve, myo means muscle, and graphy means the process of recording. Range of motion testing is a diagnostic procedure to evaluate joint mobility and muscle strength. Now we'll look at treatment procedures of the muscular system, including medications, physical therapy, and specific treatments for the fascia, tendons, and muscles. Medications include standard over-the-counter anti-inflammatory drugs, such as ibuprofen or Motrin. They act as an analgesic, relieving pain, and also as an anti-inflammatory, relieving inflammation. An antispasmodic, also known as an anticholinergic drug, acts to control spasmodic activity in the smooth muscles such as those of the intestine. Atropine is an antispasmodic that may be administered preoperatively to relax smooth muscles. A muscle relaxant such as diazepam, also known as Valium, acts on the central nervous system to relax muscle tone and relieve spasms. Many of these medications also relieve anxiety and tension. Physical therapy is treatment to prevent disability or to restore functioning through the use of exercise, heat, massage, and other methods to improve circulation, flexibility, and muscle strength. Range of motion exercises are one form of physical therapy. The goal of these therapeutic measures is to increase strength, flexibility, and mobility. The minimum goal of therapy is to restore the individual to the level of self-help known as activities of daily living. Also known as ADL, these activities include personal hygiene, dressing, grooming, eating, and using the facilities. Treatments for fascia include a fasciotomy. A fasciotomy is a surgical incision of the fascia. Fascio meaning fascia, and otomy meaning surgical incision. Fascioplasty is a surgical repair of the fascia. Fascio meaning fascia, and plasty meaning surgical repair. Treatments for the tendons include carpal tunnel release is the surgical enlargement of the carpal tunnel or cutting of the carpal ligament to relieve nerve pressure. This treatment is used to relieve the pressure on tendons and nerves in severe cases of carpal tunnel syndrome. A tenectomy is the surgical removal of a lesion from a tendon or tendon sheath. Teno means tendon, and ectomy means surgical removal. Tenodesis means to suture the end of a tendon to a bone. Teno means tendon, and desis means to bind or tie together. Tenolysis means to free a tendon from adhesions. Teno meaning tendon, and lysis meaning to set free. A tendinectomy is a surgical removal of part of a tendon for the purpose of shortening it. Tendon means tendon, and ectomy means surgical removal. Notice that tendinectomy and tendinectomy are similar in spelling but different in meaning. A tendinotomy, also known as a tendonectomy, is a surgical division of a tendon for relief of a deformity caused by the abnormal shortening of a muscle, such as strabismus. Tenoplasty, also known as tendoplasty, is a surgical repair of a tendon. Teno meaning tendon, and plasty meaning surgical repair. Tenorrhaphy is the suturing of a divided tendon. Teno meaning tendon, and rhaphy meaning to suture. Treatments for the muscles include a myectomy. A myectomy is the surgical removal of a portion of a muscle. Myo meaning muscle, and ectomy meaning surgical removal. Myoplasty is a surgical repair of a muscle. Myo meaning muscle, and plasty meaning surgical repair. Myography means to suture a muscle wound. myo meaning muscle, and raphy meaning to suture. Before you go, don't forget to check out the career opportunities on physical therapist, physical therapy assistant, massage therapist, athletic trainer, kinesiologist, occupational therapist assistant, and also the health occupation profile on physical therapist. As always, by all means, if you have any questions, bring those to class and we'll try to get those answered. And that'll do it for Chapter 4. Get out there, go and use those muscles. Be good people, do good things. See you later.